Today, we're doing a deep dive into something really crucial, but maybe often overlooked: adolescent health. This isn't just some fleeting phase kids go through. Our sources really hammer home that it's a critical window. It has these, well, profound lifelong impacts on individuals, yeah, but on whole societies too. So, we're going to explore the unique health challenges adolescents face and also the dedicated government programs trying to step up.
Absolutely. And, like always, our aim isn't just listing things off the what. We really want to get into the why. Why do these challenges hit so hard for individual well-being? And why are these specific programs so essential for the health of our communities, really?
It's all about connecting those dots, isn't it, between what happens early in life and, well, future outcomes, showing how investing in young people now is like fundamentally an investment for generations down the line. Okay, yeah, let's unpack that. Before we get into the, specific hurdles, what exactly do our sources mean when they say adolescence? It feels like a word we throw around a lot, but I'm guessing there's a more precise definition guiding these health efforts.
That's a great place to start, actually, because the definitions, they are a bit more nuanced than you might first think. So our sources, they mainly define adolescence as that period between puberty starting and physiological maturation ending. That roughly puts it between, say, 15 to 19 years old. But they also use a broader definition sometimes, covering ages 10 to 19. And what's really helpful for planning health stuff is how they break down related terms too. Like youth usually means 15 to 24 years, and then young people is the widest net, covering everyone from 10 all the way up to 24.
Ah, okay. So it's not just one strict age bracket. It's more like a developmental journey with
Hmm.
these sort of flexible lines. Sounds like understanding those distinctions is pretty key to actually helping young people effectively, right?
Precisely. Yeah, recognizing these different age ranges is crucial. It lets health initiatives really target who they need to reach. Whether it's programs for younger teens just hitting puberty, or maybe for older youth navigating that jump into adulthood. These distinctions, they help tailor the help to the very specific needs and, frankly, vulnerabilities of each group. It's about meeting them where they actually are.
Right. That really sharpens the focus. Okay, so with that framework, what are the big health challenges facing adolescents? What makes this stage so uniquely vulnerable based on what your sources are saying?
Well, it's a really complex picture and often quite precarious, honestly. Adolescents are just. They're a vulnerable group because everything's changing so fast. Physically, emotionally, socially. They're dealing with new freedoms, new pressures, often all at the same time. And our sources, they systematically lay out several key challenge areas.
I'd guess reproductive and sexual health must be pretty high on that
Yeah.
list.
Oh, absolutely. It's a critical area, no question. Take adolescent pregnancy. It accounts for something like 11% of all pregnancies in many developing countries. And these are often described as at risk, often unwanted pregnancies. They can lead to really serious health consequences for both the mother and the child. We're talking mortality, morbidity, even secondary sterility down the road. And then there's the huge public health issue of STDs, sexually transmitted diseases, including HIV/AIDS. A lot of this is driven by, well, widespread ignorance about the risks involved, and often a lack of access to, contraceptive advice or services. Tragically, HIV/AIDS is still a leading cause of death for adolescents globally. And it's not just about access either. There's this ambivalence some teens feel about even seeking contraception. That complicates things a lot.
Hmm, that's a powerful point. The internal barriers, they can be just as big as the external ones, can't they? Okay, so beyond physical health, what about mental well-being? We hear so much about the pressure on young people these days.
Yeah, mental health is definitely a significant challenge, and it seems to be growing. It becomes even more noticeable when, major killer diseases get under better control and societies are changing really rapidly. A lot of the issues adolescents face, they often stem from deep-seated things like insecurity, feeling incompetent, or maybe the fallout from problems at home like marital discord, parental rejection, or even institutional rearing. The sources actually describe that transition to adulthood as potentially stormy, and this can manifest as mental ill health or sometimes even juvenile delinquency. Specific things highlighted include psychosis or bipolar disorder. Now, these affect less than 2%, but they can cause moderate to severe disability. And then you have phobias and anxiety disorders, which are also significant. And interestingly, they affect about twice as many young women as
Yeah.
young men.
Wow. It paints a picture of just intense internal and external pressures kind of colliding at this really formative age. Are we also seeing things like substance abuse becoming more common?
Unfortunately, yes. That's a clear trend the sources point to. Alcoholism and drug addiction are definitely growing concerns. And the data indicates some worrying patterns like the average age of drug users getting younger, and also an increase in people using multiple drugs, polydrug use among adolescents. It really highlights the need for, earlier intervention and more targeted prevention.
And nutrition, that's always so fundamental for health. I bet it plays a big role here, too.
Definitely. Malnutrition and anemia, they're quite common, especially among adolescent girls. But it's not just about obvious undernourishment. There's also hidden hunger.
Hmm.
That means micronutrient deficiencies lacking essential vitamins and minerals. And that can have devastating effects, like leading to mental impairment, poor health overall, low productivity. It's considered so critical that tackling the nutritional needs of adolescent girls is actually a specific target within the Sustainable Development Goals, the SDGs. It really is a bedrock issue.
That's a stark reminder, yeah. How fundamental these things are. What about physical safety, exposure to violence?
Another really serious area of concern. Road injuries, believe it or not, are a leading cause of death for adolescents globally. But beyond accidents, this category, injuries and violence, it also covers things like gender-based violence, intimate partner violence, non-partner sexual violence, even practices like female genital mutilation or cutting, and early marriage too, which our sources frame as a form of violence against young girls.
Wow, that is an incredibly broad and heavy spectrum of threats. And what about non-communicable diseases, NCDs? We usually think of those affecting older adults. Are adolescents a focus there too?
Increasingly, yes, they are. Adolescents are actually a key focus for NCD prevention strategies because the health behaviors that get established during these years, things like diet, exercise, whether you smoke or not, they massively influence your risk of NCDs later in life. So investing in healthy habits now is basically an investment in preventing chronic diseases down the road. What this really shows is a strategic foresight. These programs aren't just trying to treat symptoms. They're trying to fundamentally reshape the health trajectory for a whole generation. It's proactive. It's an investment in future generations, really.
The scope of these challenges is just vast, which naturally makes you ask,
Right.
how are governments even starting to tackle all this? This is where, I guess, the National Health Missions programs come in. It sounds like a really integrated approach.
You've nailed the key point there. It absolutely demands a comprehensive, integrated approach. And that's exactly the shift we're seeing in government programming, according to our sources. They highlight several key initiatives. One of the really significant ones is the Reproductive, Maternal, Newborn, Child, and Adolescent Health Strategy, or RMNCH+A for short.
RMNCH+A, that's quite a mouthful. What makes that strategy so pivotal?
Well, it was launched back in February 2013, and it really marked what the sources call a paradigm shift, because it was the first time adolescence was formally included as a distinct life stage in this kind of strategy. The whole approach emphasizes a continuum of care, linking up different health aspects, its main priorities, things like adolescent nutrition, especially iron and folic acid, or IFA, supplementation, plus facility-based services for adolescent reproductive and sexual health, ARSH, through dedicated adolescent health clinics. They also focus on providing information and counseling on ARSH and other health stuff, dealing with menstrual hygiene and offering preventive health checkups.
Okay, so these ARSH clinics, they sound like a central hub for a lot of this stuff. What kind of care can teens actually get there?
They are definitely vital hubs, yeah. These clinics, they offer routine checkups, they provide contraceptives, they help manage common issues like menstrual problems or RDITIs, reproductive tract infections, and sexually transmitted infections. They also provide antenatal care if needed and address anemia. But beyond the clinics themselves, there are dedicated ARSH and ICTC counselors. ICTC is for HIV testing and counseling. And these counselors offer really comprehensive guidance on all sorts of topics: nutrition, puberty, preventing RTIs, contraception, also delaying marriage and childbearing, dealing with sexual abuse, and importantly, mental health problems. And they don't just wait for people to come to them. They do outreach activities in schools, colleges, teen clubs, at village health nutrition days, health fairs, trying to get the information out there. It's a real multi-pronged approach.
That sounds deeply holistic, actually. What other programs are crucial in this whole landscape?
Another really key initiative is the Rashtriya Kishore Swasthya Karyakram. That's RKSK. This was a newer program launched in January 2014, and it targets a huge number, 253 million adolescents. Its focus is significantly broader than just reproductive and sexual health. It also brings in life skills, nutrition, injuries, and violence, including gender-based violence, NCDs, mental health, and substance misuse. A really key aspect of RKSK is that it promotes peer-led interventions right there at the community level, which are then backed up by the facility-based services we talked about.
Peer-led interventions, that sounds smart. Reaching young people where they are, often through people they actually trust, shows an understanding of adolescent psychology, doesn't it? And you mentioned nutrition earlier, specifically anemia being a problem. Is there a program just for that?
Absolutely. The National Iron Plus Initiative, or NIPI, launched in 2013. It's a really important piece for adolescent health. Its whole aim is preventing and controlling iron deficiency anemia, not just in adolescents, but also younger children and women of reproductive age. But for adolescents, age 10-19, a key strategy is the weekly iron and folic acid supplementation, YFS they call it. This provides supervised weekly IFS supplements a specific dose of iron and folic acid. And it includes deworming twice a year too, because worms can contribute to anemia. So it's not just handing out pills, it's a consistent supervised program to make sure those nutrients actually get absorbed to make a difference.
Menstrual hygiene, you mentioned that earlier too, as vital but maybe often overlooked for adolescent girls.
Yes. There's the menstrual hygiene scheme. This was launched by the Ministry of Health and Family Welfare. It specifically targets adolescent girls aged 10-19, particularly in rural areas. The main goals are pretty straightforward. Make sure girls have good knowledge about hygiene, that they have access to good quality sanitary napkins, and that there are safe ways to dispose of them. So the activities involve things like community health education, making sure napkins are regularly available, training community health workers, the ASHAs, and designated teachers in schools, and promoting safe disposal methods.
These sound like really practical ground-level interventions, tackling a sensitive but totally fundamental need. Are there programs focused on broader health screening for this age group? Catching problems early?
Yes, very much so. That's where the Rashtriya Bal Swasthya Karyakram, or RBSK, comes in. Launched in February 2013, it provides child health screening and early intervention services, and it covers kids right from birth all the way up to 18 years. It operates with a focus on the 4Ds: defects at birth, diseases, deficiencies, and developmental delays, including disability. Screening happens both at Anganwadi centers for the younger kids and in government or government-aided schools for those aged 6 to 18. They have dedicated mobile health teams doing this. And crucially, the program ensures free treatment or intervention for any conditions they identify. So it's basically like a comprehensive early warning system plus a repair service for young people's health.
That's an impressive screening setup. And schools. They seem to pop up again and again as a vital place to reach adolescents. Do they have their own dedicated programs?
They absolutely do. Under the School Health Program, which is part of the larger Ayushman Bharat initiative, this program is specifically aimed at promoting health and well-being among school kids and adolescents. Its components include age-appropriate health education, covering everything from nutrition, physical activity, hygiene, to disease prevention, puberty, mental health, substance abuse, sexual and reproductive health, preventing violence, even road safety. They even have designated health and wellness ambassadors within schools. Their job is to help link students up with other programs, like the WISE for iron supplements or RBSK for screening, and make sure kids get referred to adolescent-friendly health centers or health and wellness clinics when needed. It also integrates screening for 30 different diseases, including malnutrition and anemia, under the RBSK umbrella. And there's provision for electronic health records for students, plus training in emergency care, like first aid. It's an incredibly robust system, really trying to connect multiple services right where adolescents spend so much of their time.
It really sounds like a deeply integrated network, doesn't it? Linking multiple services using existing places like schools. Are there any older, maybe more established programs that have been adapted over time to include adolescents?
Yes, indeed. The Integrated Child Development Services, or ICDS. Now, most people know ICDS for focusing on children under 6 and pregnant or nursing mothers. But it also targets adolescent girls, specifically those aged 11 to 18 years. It provides services like supplementary nutrition, immunization, health checkups, medical referrals, plus nutrition and health education, and even non-formal education. And within ICDS, there are specific schemes like the Kishori Shakti Yojana for adolescent girls generally, and a dedicated nutrition program for adolescent girls for those identified as undernourished, covering ages 11-19.
Right. And what about mental health on a larger scale? You highlighted that as such a big challenge earlier. Are there broader national initiatives tackling that specifically?
For mental health, yes, there's the National Mental Health Program. This one's been around a while, launched way back in 1982. Its broad aim is to ensure mental health care services are available for everyone, and that definitely includes adolescents. Its activities cover things like school mental health services, college counseling services, workplace stress management, which might affect older adolescents or young adults, and crucially, suicide prevention services. This program shows there's been a long-standing recognition of mental health as a public concern, and it's been adapted over the years.
It's truly impressive how many different angles these programs seem to cover, from specific nutritional needs to mental health safety.
And one more to mention, Poshan Abhiyan. Launched more recently in December 2017, this initiative specifically targets adolescent girls, among other vulnerable groups, with the goal of improving their nutritional status. It plays a really important role in ensuring convergence, making sure different programs like the National Health Mission and ICDS work together effectively, especially on nutrition. What this whole suite of programs really reveals, I think, is a strategic shift. Instead of just isolated fixes for single problems, these initiatives are trying to build a multi-layered, integrated defense system around adolescents, recognizing that their health isn't just one thing, but this complex web of interconnected factors.
So wrapping this up, what does all of this really mean for us, for you listening? We've unpacked this critical stage, adolescence, looked at its unique and pretty complex health challenges, and explored these dedicated, comprehensive strategies governments are using to try and tackle them.
What's really striking, I think, is how these programs clearly reflect a deep understanding. An understanding of how health behaviors and the risks faced during adolescence really do have lifelong impacts. It signals a definite shift towards more holistic integrated care, moving from just basic community stuff all the way up to specialized services in clinics and hospitals. It really recognizes the foundational role that adolescent health plays in the well-being of society as a whole. It's a long-term vision, in action.
Absolutely. This whole integrated approach, it seems to underscore a real long-term vision for the health of entire nations. So here's a final thought for you to take away. Considering just how broad the impact of adolescent health is on future generations, and given the really diverse challenges this group faces that we've talked about, what aspects of well-being for young people do you think deserve even more focused attention, perhaps more innovation, especially in the rapidly changing world we live in today?